Hello, and welcome back to News Channel 24. Today, we're going to be asking ourselves, what is healthcare like in America? At this point in time, the Supreme Court has yet to determine the exact place of healthcare in the government. There are many opinions across the liberal and conservative political spectrums. Many liberals would claim that healthcare is a fundamental right, while conservatives argue that it is a privilege that should not come covered by the government. The fact of the matter is that healthcare was the most substantial issue to hit the polls in 2018, continuously remaining at the top priority of voters. Therefore, the debates and discussion regarding healthcare are of obvious importance to contemporary politics. So, what exactly has been accomplished?
Well, in 2010, the Affordable Care Act was signed into law and shortly thereafter nicknamed Obamacare. This act is commonly referred to as the beginning of deepened political partisanship in Congress and across America. Republicans in Congress were angry that their ideas were being ignored in the legislation process by the Democrats, and publicized their anger and disappointment, which led to widespread protests by conservatives across the nation. Over the next few years, Republicans made it their mission to take down Obamacare and to emphasize just how ineffective they believed universal federal health care is.
In this report, we will be discussing the varying opinions and the complexity of current healthcare opinions and debates. Here to tell us about the perspectives shared by many liberals is our anchor, Nicole.
Democrats stand behind the Affordable Care Act, as 20 million Americans now have health insurance, by cutting the number by those that once said did not have health insurance by half now. The concept behind quality healthcare is that every American has a fundamental right to healthcare coverage. Democrats also think that making it widely available and affordable for the average American, it will help rebuild the economy. As seen during former President Barack Obama's time in office, healthcare spending increased by 3.9%, and ended up producing around 500,000 jobs. And it is estimated that the Medicare for All plan could save the U.S. economy about $200 billion per year, while expanding the access of healthcare services. But to expand beyond the current system that is already in place, the aim of universal healthcare is to ensure that everyone can use the health services without the risk of financial ruin, or no matter their current socioeconomic situation. This could be ranging from clinical care for individual patients to the public services that protect the health of the whole population. Under universal healthcare coverage, there would be no out-of-pocket payments that would exceed the given threshold of affordability. This is usually set at zero for the most poorest and disadvantaged people. All governments should then therefore decide what health services are needed and how to make them universally available, affordable, efficient, and of good quality. One of the biggest pros for universal healthcare is that there's a system that's already in place. For example, here in the US, we have the private healthcare system, which provides insurance that are covered by employee-sponsored or a group health insurance plans. Being one of the 25 wealthiest nations in the world, the US is the only one that does not have health insurance, universal health insurance. While the highest health per capita of any country, with all that money being spent, one would figure that the US is all super healthy, but it's not the case. In the latest Service of Organization of Economic Cooperation and Development, which assessed 13 developed nations including Norway, Australia, and the UK, the US actually had the lowest life expectancy and the highest rate of infant mortality, highest rate of heart disease, and amputation as a result of diabetes. Of all the developed countries in the world, the US possesses the distinction of having both the most expensive healthcare in the world while being the less effective. But in the past year, taxpayers in the US has picked up at least 65% of the country's total healthcare coverage. That is about $2.1 trillion in taxes. Now, keep in mind, this is what we're already paying in taxes. Now, on top of that, you have to take account of how much money we will spend in our private healthcare systems for every month. In other words, the US already pays the same amount that we would fund for universal healthcare, but now the public is not getting any of those benefits. Now, comparing the differences from a single-payer government-funded system used in the UK, known as the British National Health Services, NHS. The NHS employees, including healthcare providers, are all employees of the UK government. The UK system is just one of the many examples of the different ways that the single-payer government system can work. Like most developed countries, Britain ranks above the US in most health measurements. Its citizens have a longer life expectancy rate, a lower infant mortality rate, and the country has a more accurate hospital bed per capita, and fewer deaths are related to surgical and medical mishaps. Britain has achieved these results while spending approximately less on healthcare than the US, about $2,500 per person in Britain, compared with $6,000 in the US. For these reasons, the World Health Organization, WHO, ranked Britain 18th in the global league table of healthcare systems, while the US only ranked 37th. This successful government-run insurance serves as an effective model for the universal healthcare system and how it can work for an entire nation like the United States.
Thank you, Nicole. And now we'll hear from Pilar, who's here to tell us all about the perspectives of many conservatives in America.
If there's anything that both conservatives and liberals agree on, it's that there is a dire need in the United States for healthcare reform. While liberals glorify the universal healthcare system as a solution, conservatives recognize that this is an ineffective solution. The main problem surrounding universal healthcare is as follows. Most federal programs are implemented through the use of the country's bureaucracy, meaning the program has to go through lots of people before even reaching its target citizens. In addition to this, those who work in the bureaucracy frequently have to jump through hoops, perform very specific tasks, and stick to strict rules just to accomplish their goal. This process of using the bureaucracy is slow, cumbersome, and inefficient. If the United States were to implement universal health care, it would most likely be implemented through a bureaucratic agency, making the actual execution of universal health care extremely difficult. So what do conservatives support? Conservatives support the idea of spurring competition in the healthcare market. This aligns closely with their general support of free markets. The idea is that the patient have complete control over which healthcare plan they have, as well as have many options to choose from, such as plans that stem from employers, religious organizations, and other groups. With so many options to choose from, conservatives predict two things. First, that this competition will force health insurance companies to be more transparent about their practices, results, etc., seeing as they can be easily compared to their competitors. Second, conservatives predict that competition will significantly drive down health insurance costs. For conservatives, being able to choose your own healthcare at a lower cost is the obvious solution in the fight for healthcare reform.
The healthcare debate today can become very heated and passionate, so it is important that we keep in mind just how many Americans are affected by our debates and discussions. With the upcoming presidential election in November, it is vital that we all educate ourselves on the positions of candidates running for office when it comes to healthcare. Potential nominees such as Kamala Harris and Beto O'Rourke no longer present strong healthcare plans as part of their campaigns. In fact, they have purposely backed off from answering questions regarding healthcare by the media. So it is important that we continue to press this issue on social media, at political rallies, and in the polls. Determine your stance on healthcare and fight for what you believe in. That's all for today. Thank you for tuning in.